Welcome, friends, to the TeleWellness Hub podcast. I'm your host, Sandhya Nagabhushan. Today, I'm joined by Dr. Natalie Feinblatt. Dr. Natalie is a licensed clinical psychologist specializing in trauma and addiction recovery. She works with adults who are navigating complex PTSD, substance use, and the long-term impact of painful life experiences. Her approach is compassionate, trauma-informed, and deeply affirming, helping people heal the root causes beneath addictive behaviors and reconnecting with themselves in a meaningful, sustainable way. I'm so glad she's here to talk today with us about recovery, trauma, and addictions. Welcome, Dr. Natalie.
Hi, thank you so much for having me. I really appreciate it.
Thank you for being on the show. We're really excited to have you on the show with us today. So I would like to start off, Dr. Natalie, with a very pertinent question. Why do you do the wellness work that you do?
Oh gosh, it feels like that could be a very long answer. I would say that I do the wellness work that I do because I think, like many people who end up getting into healthcare and mental health care, that I just find a lot of meaning and purpose in helping other people. And more specifically beyond that, I think that many, possibly most, I won't say every therapist, but many therapists get into this line of work because we've had our own struggles along the way, and therapy or mental health care really helped us. And I would definitely fall into that category that, I've had my own struggles, and that, going into the field of mental health was not only, a way to make a living and help other people, but it was also kind of just a continuation of a lot of the work that I had been doing kind of, personally.
Thank you. I actually can concur with that. I'm a licensed professional counselor, and I also specialize in substance use work. And just being candid, I've had family afflicted with addictions, which kind of paved the way for me to want to learn how to help others in my family heal, but on a bigger, much larger scale, help others heal in their journey. So thank you for that introduction. Lovely. So Dr. Feinblatt, I would like to start off with just asking a generic question about why do trauma and addictions go hand in hand? Why do they go together? From your perspective, what's the connection between trauma and substance use or addictive behaviors?
And you can just call me Natalie. You don't have to call me Dr. Feinblatt.
Thank you.
Yeah, of course. So, I mean, the thing that I usually say at first when people ask about this is, I initially got my start in addiction treatment. That, here in LA, there is a preponderance of addiction treatment centers. And if you're, becoming a therapist in LA, it's almost impossible for you to not end up at one of those places of somewhere on the line. And that I started out there, but that from my point of view, that you can't really specialize in addiction without also specializing in trauma, because the Venn diagrams of those two populations overlap so heavily. At this point in my career, I don't even know how many people I've worked with who have addiction issues, but the number of them who legitimately seemed to have no trauma history whatsoever, I can count on my fingers. Like it's such a small minority of the folks that I've worked with. And so I suspect, just based on my experience, that a big part of the connection is the trauma and self-medicating for post-traumatic stress. I think that, a lot of people who experience trauma will not know how to handle it, because we certainly don't really learn how to handle it in our society, at least here in America. And if they go on to then develop post-traumatic stress, it just makes sense that one of the ways to try and deal with that albeit it becomes its own problem, but is to over rely on substances, whether it's alcohol or drugs or whatever it might be, right? And so I think that, are there plenty of people who don't go in that direction? Sure, they go in other directions to try to, survive dealing with post-traumatic stress. But I think an awful lot of people go for substances because, especially when we're talking about like, alcohol or marijuana, like they're so readily available.
Absolutely.
They're not necessarily expensive, and they work for a while, right? Unfortunately, they don't work forever, and they usually tend to end up causing more harm than good the longer it goes on. But it makes sense that folks would go in that direction if they have a trauma history.
Absolutely. And to that point, trauma, the word trauma is thrown around a lot, big T, little t. Can you speak on or expand a little bit about what is trauma, and perhaps what are the signs of symptoms? Say a potential client comes to you and says, how do I know if I have a traumatic history, or how do I know what are the symptoms of signs of trauma?
Sure. Well, I know that this has become a real point of conversation in the mental health field and just in popular culture in the last 5 or 10 years, because I think that we are coming to expand our definition of trauma, which I personally think is a good thing. And I know that I've heard and read some people who are concerned that we're like over-diagnosing trauma. And I don't know, my own personal opinion is like, I would much rather go in the overdiagnosed direction than the underdiagnosed direction when it comes to trauma. And I don't really think that there's that many therapists running around saying that, like, because you skinned your knee when you were 5, that was trauma. Like, I don't, I think we generally reserve that definition for things that left a negative mark on somebody. So what I will say about my own thoughts on defining trauma is that, it can be kind of the quote unquote classic stuff, like, almost dying or becoming incredibly injured, being in a situation where you watched somebody die or get, hugely injured, getting into a car accident, or, something like being physically abused, sexually assaulted, all of that stuff. And then I would also say that there's also the, developmental relationship trauma that can happen in highly dysfunctional or abusive families where, maybe there was no physical abuse, maybe there was no sexual abuse, but there was, years and years of repeated, negative interactions, emotional dependency, codependency, people having, angry outbursts, violent outbursts, things of that nature. Because I work with a lot of folks who have CPTSD, when you have experienced like chronic trauma in relationships over years and years, that can be like the big T stuff, but often it's also, more kind of insidious and emotional or adjacent to like coercive control and things like that. And to me, that stuff is definitely also trauma, because I see people dealing with the after effects of it every day, and it certainly impacts them as a trauma would impact somebody.
I'm really glad that you distinguish those ideas or those constructs, because like you said, I think many people hear the word complex PTSD or trauma, and they think, war veterans, which are absolutely giving them breath and breath.
Oh, yeah.
But I also feel, and I mirror your sentiments, there are those silent ones that maybe go without having been able to express themselves, growing in an invalidating environment at home, maybe having an early attachment disorder. or attachment style. So I think that's really important distinction that you pointed out there, that our awareness or our recollection in society may jump to think it has to be something like you said, physical, like years and years of physical or sexual assault or abuse. But sometimes the more insidious ones, as you pointed out, that distinction there, are the ones that are left unsaid or left unheard, have not having a voice. So thank you for clarifying that. I think that was really important point to make in the world of healing in terms of trauma and how people maybe sort to unhealthy coping mechanisms.
Yeah.
Tell me a little bit, Natalie, what would trauma-informed addiction treatment look like in the practice for someone maybe thinking about starting therapy and needing to see a specialist like yourself? Can you give us a little insight about what that treatment may look like?
Sure. I would say, first and foremost, it would be a thorough assessment to see if a person who is coming to therapy due to, having an addiction has a trauma history, right? And looking at all the different kinds of trauma, like we just discussed, right? Not just the big stuff or the classic stuff, but like the other stuff as well. Because like I said, in my experience anyway, the odds that they will are like very, very high. So making sure to assess for that, get a history on that. And then I would say also working with the person to plan to possibly do some more intensive trauma work, depending on where they are in their recovery, right? If they're like trying to get sober or very newly sober, it might not be the time to like dive into all that trauma stuff, but to know that there is definitely a plan for getting there once they've stabilized with their addiction more. So stuff like EMDR or brain spotting or internal family systems work, things of that nature. And then I would also say that a part of trauma-informed addiction therapy would be a couple things that I run into with a lot of folks is, first of all, and this can be the case for anybody. I mean, it's frequently women, but it doesn't have to only be women. But, going back and seeing if they do have anything in their history where they were, assaulted or taken advantage of when they were intoxicated, making sure that they know that that was not their fault. And it wasn't like, oh, well, I set myself up for that by being so drunk or so high or whatever, right? Letting them know that, okay, do you have a role to play in your substance use? Of course. And that doesn't mean that when somebody sees you intoxicated, that gives them the right to do things to you that you're not consenting to, right?
Correct.
So making sure that they know that. And also making sure that if they are going the route of 12-step programs, which I am generally in favor of 12-step programs, but I don't ever force them on clients who just aren't interested. But if they're doing that and they are working the steps and they, come to step 4, which is making an inventory, one of the places where, in my opinion, AA, Alcoholics Anonymous and Narcotics Anonymous still need to do a little catching up is that, you will often get a sponsor who, you will put your trauma on your inventory and they will say, well, what was your part in that? Right. And it's like, that is not, in my opinion, a very trauma-informed approach to that. I am a fan of doing an inventory. I think it can be incredibly helpful. And at the same time, there are certain things in a person's history that they did not play a role in, whether it was abuse they experienced when they were a child and they were literally powerless to do anything about it, or things that they experienced while they were intoxicated. If, we were just talking about if they were sexually assaulted or something like that, they don't have a part in that either. That is all on the perpetrator, right? And so I think that making that clear to people who are going through that process can also be very helpful in terms of making sure things are trauma informed.
Yes, Natalie, I think that's so important to point out those different silos and levels of treatment that happen when a patient first walks in the door and is looking for help with their substance use or trauma history. And one of the key things that you pointed out that I really agree and mirror, in fact, I do the same work with my patients, is assessing where they're at and what space they're in, correct? Or the idea, let's not push too heavy EMDR or too early on, because they may not have the tools in their toolbox to self-soothe, regulate themselves, and then that may just turn them back to their substances, right?
Yeah.
And yet that other point that you pointed out, and I really do think this is powerful language that you use, is the language that we are using when we're talking about trauma-informed treatment and substance use work, because as you mentioned very clearly, and I'm glad that you pointed it out, the 12-step program is wonderful and has many wonderful place in terms of recovery. However, I start to also want to point out that, you know, as a child, if you were sexually assaulted or if you were a survivor, there's no space in trying to blame or to use language in blaming the survivor, right? So
Yeah.
I'm glad you pointed that out, Natalie. That's so important for people on the show to hear that. Maybe someone could be thinking, oh, well, I think something may have happened to me in the past. I'm not sure. Was it my fault? I was drinking. So that's so important for you to point that out and empower people to understand there's not a space there should be no space in blaming the survivor.
Yeah.
Absolutely.
The TeleWellness Hub podcast is now proudly hosted by Legal Med 180, a platform bringing together people in law, healthcare, policy, and innovation to improve real outcomes for individuals and communities. We believe better mental health and wellness happen when caring professionals collaborate across systems. That shared mission is why this partnership matters. Check out legalmed180.com to learn more.
I want to we often hear people talking about how long does this journey take?
Yeah.
And I hear it from my own clients, my own patients. I hear it from friends of mine that are in recovery. What does the timeline, we live in a very fast-paced world, a capitalistic society. People are, need to get back to work. What do you speak to that? What can you say when someone asks you, well, Dr. Natalie, how long is this going to take? What's the healing process like? Yeah,
I do my best to be as honest with people as I can around that. And I'll say, I know this might not be what you want to hear in terms of we're going to get through this in a couple months, but what I will typically say to people is, if they are coming to me for a single incident trauma, right, where it was one thing, I worked with somebody who, was present, luckily unharmed at a mass shooting, but that was literally the only thing in their life that would really kind of qualify or count as significant trauma, right? If that's the case, we could conceivably, depending on what kind of work we're doing, whether it's EMDR or something else, we could conceivably get through that in a matter of months, 3, 4, 5 months or something like that, depending on how often we're working together and, all of that stuff. However, when we're dealing with something that's more complicated, a history of multiple traumas or, growing up in an abusive or dysfunctional family and trying to work through all of that, that can take years sometimes. And obviously, there are things that people can do to try to speed it up, working on stuff in their own way between therapy sessions and, maybe going to support groups and whatever else. But, even when we're doing something like EMDR, where, a lot of people will say like, oh, this is so much faster than traditional talk therapy.
Sure.
I'm always kind of like, I don't know that I totally agree with that. I think sometimes it can be, but other times I think it can take a significant amount of time still. The good news is that hopefully, using that in therapy or whatever will really make a huge difference, and the person possibly won't need, regular therapy down the line, because it was thoroughly reprocessed. But I would say it really depends on what we're dealing with.
Absolutely.
And I would also say that I recognize that being able to be in therapy for months and years is a privilege, and it is not available to everybody, especially not in the United States.
Right.
And so I think that there are other options in terms of support groups, books, podcasts, all that stuff. That therapy is one way to work through this stuff, but it doesn't have to be the only option, especially if, somebody is just not in the position of being able to afford that financially or in terms of time or things like that.
You mentioned eye movement desensitization reprocessing. I love EMDR. It's the bread and butter of what I do with my work.
Yeah.
But for our listeners, can you give maybe a brief snapshot or synopsis of what EMDR is and how does it play out in treatment?
Yeah, and I can certainly try. I really struggle to have like an elevator pitch for EMDR because there's, as you know, there's just so much to it.
Yes.
So I will try my best, but feel free to add things if you want to. So eye movement desensitization and reprocessing is a specific kind of form of therapy that follows a protocol of using bilateral stimulation, which is just a fancy way of saying like alternating left, right. Usually it's eye movements, but it can also be auditory or tactile or whatever. Using that as a tool to help someone reprocess past trauma in a more thorough and complete way. And as opposed to talk therapy, where we're mostly focusing on thoughts and emotions, EMDR also brings the body into the picture, which is very valuable because trauma has a huge impact on the nervous system and the body. And it's a way of tuning into your thoughts, feelings, and body while reprocessing trauma with the bilateral stimulation, in such a way that you're able to kind of move from it being something that intrudes onto your day-to-day life to just another experience that you've been through that you still have your feelings about, but that isn't causing you symptoms of post-traumatic stress.
That was a lovely explanation. To be
Oh,
honest,
thank you.
it was really well explained because I think, like you said, there's not it's such great work we do with EMDR, and typically people hear EMDR and they're like, is it hypnosis? Am I in control? What exactly is going on? So it's important to point out that the patient is always in control of the session.
Oh yeah.
Yes, and the beautiful part of EMDR is that it gives the power back to them, right? It gives them the onus, the autonomy, the agency to take, and like you said, through the reprocessing and the dual attention stimulations or bilateral stimulations. I've heard my patients say, and please chime in here, I've heard them say, you know what, Dr. Sharma, the story is still there, the narrative is there, but it's almost like a distant, they feel removed from it, almost like a storyline or a movie that's passing on a train. So I think that's powerful language that I've heard my own patients tell me, and I've heard other people explain it. And the other part that I would agree with you is EMDR is one of many tools, right? So
oh yeah,
the work is making sure that after our session with EMDR, they have the tools, their coping skills, emotional regulation, all of those really good things that are going to help them stay baseline, because it's not easy work to talk about trauma, right? It's very, it can be very destabilizing. You mentioned,
Yeah.
I'm sorry, go ahead.
No, I was just agreeing with you. Yes, it can be destabilizing. So it's important to get the coping skills part of it as well.
And you mentioned the piece about the central nervous system and how um, the body feels trauma or holds on to trauma. Can you help us learn? And this part I'm actually fascinated with, Dr. Natalie, is the neuroscience piece. Can you help us explain what goes on in the brain? What does neuroplasticity look like? Oh, this is, a big wave of where everything is going right now in terms of, things we hear on podcasts and things we hear in the medical literature. Can you help us learn a little bit about what happens in the brain, the neuroplasticity piece and the neuroscience part?
Sure. So, when we are talking about trauma, and mostly in our thoughts about it, we're in the prefrontal cortex, which is just the part of your brain that's right behind your forehead. And it's where we do most of our thinking. It's like the planning, strategizing, thinking part of it, right? And that part is very important. Like we use it all day, every day. But it's not the full picture, right? We also need to get into kind of the middle of our brain, which is, the limbic system, which is where the emotions come up. That part is also important, which is why it's good to not just talk about feelings, but try and feel feelings, even during the session or during, EMDR or whatever technique we're using. And then we've also got to get into the nervous system, right, which runs throughout our entire body and is, affecting our body every minute of every day. So to be able to utilize all three of those areas in trauma treatment is very important because trauma impacts all three of those areas, and only really going into one of them. And, in therapy, I think we're guilty of going too much into the thought area. That's only part of the picture, right? And then in terms of neuroplasticity, this is a talk I have with most of my clients at some point or another, is that we now understand that the brain is capable of changing throughout the lifespan, which is awesome. Like it's not like, oh, you've hit 40, like you're stuck with your brain the way that it is, right? Luckily, the answer is no, and that we're still able to change our brains. The only downside is that the older we get, the more work it takes to do that, right? Like when we're young and our brain is very, squishy and moldable, our brain doesn't take as much effort to change. But the older we get, the more we really need to, focus on repetition and practicing new things in order to create new neural pathways. And, EMDR is one of the ways that we do that, but even honestly, just practicing your coping skills when you might not have thought to do that in the past is a form of neuroplasticity and working to change your brain, right? So it takes effort, which is and repetition, which is not fun, and time, but it is possible, which to me is the hopeful thing. It's just gonna take work.
So for our listeners that are hearing this explanation on neuroplasticity and how trauma and healing is impacted by the different circuitry in our brains and neurotransmitters, am I hearing you say that things can be reversible and we fire off new synapses or new rewiring? Is that what I'm hearing you say, that we can actually reverse some of these things?
Yes, I would say that we can. I mean, this is another question along with the how long is this going to take question. Another question, and I'm sure you get it too, is like, can I be cured? Can I be fixed? Can this go away? Right? Can this be reversed, or however it is that people say it when it comes to, symptoms of post-traumatic stress or whatever it is. And to me, the answer is yes. Mm-hmm. And, we need to make sure to have realistic expectations around this. So for some people, do all of the symptoms of PTSD, go away for the most part? Sure. But what I see happen to most people is that the way I'm a therapist. We love metaphors and things like that.
Yes.
The one that I usually use here is like, your PTSD right now is like this radio that is blaring this music that you don't like, and you can't get rid of it, and you can't turn it down or off, right? Mm-hmm. And so what we're going to hope for here, and what I see happen, is that we can get you to a place where we can turn the volume way down. And sometimes it might even go off for periods of time. And you might even be able to change the channel sometimes. And so I think that is a realistic portrait of what is possible. It's like, okay, are some people able to get rid of the radio entirely? Sure. But what I see more often is that, it is healable and reversible within a realm of reality where it's not just going to magically disappear, but it can get a hell of a lot better.
Natalie, I love that metaphor. And you're right, as therapists, we have a lot of metaphors that kind of keen to the patient or the client. That's a lovely metaphor. I was actually visualizing that myself and encapsulating it, because you're right. It's for some patients or some clients, it's not the idea of, they may come into therapy thinking, okay, Dr. Natalie, cure me, heal me. well, yep. That's a loaded and a loaded question right there. And so the idea is, maybe for some patients it looks like this, but for some other patients it looks like a little different. Turning down that noise, to where it's tolerable, and using our coping skills and gathering our support system, reconnecting with our folks, not isolating our support systems, things like that. I love that metaphor, Natalie. I have to be honest. I really think I'm going to try to use that with some of my clients. Beautiful, beautiful metaphor. And I think it really symbolizes, you're right, toning down some of that so that patients can implement their coping skills to continue to work on their journey of healing. You know what, Natalie? I think at this point, I want to thank you so much, because we're almost out of time today. But I want to thank you so much for being on the show with us. It's been an absolute pleasure. I've learned so much from you, Natalie, and especially about the science piece. I think people get really, really intrigued by that, and you gave such an excellent explanation of that. So I want to thank you so much, Dr. Natalie Feinblatt, for sharing your insights and being part of our wellness journey today. Thank you, Doctor.
Of course. Thank you for having me.